So I would say once ladies go home after a breast reduction, the breasts are feeling tight, they're high, they're taut, they're sore. Many ladies do the reduction just with Tylenol and ice packs. So it's not necessarily super painful, but I'd say the majority of people will take at least a few doses over the first couple of days of pain pills. And so and they just had surgery and they're thinking about it and it's all kind of in their forebrain. And then by the end of a week, most people are up and moving around, oftentimes driving and starting to take on more thoughts of the outside world again. And then if they bump things or whatever, they remember that they're still sore if they really stretch or do stuff like that. I usually limit exercise for 3 weeks. So for folks that are really sort of exercise obsessed, that's really tough. But then it is done at 3 weeks. And then energy is usually normal by somewhere between 4 and 6 weeks. And so at that point, you know, I would say most ladies really just take off and they are not particularly sore. Again, every now and then may get a little ping or a zing, a little nerve waking up or something that reminds them they had surgery recently. But most of the time they are really back to normal and not thinking about their surgery. And because when they walk in right after surgery, they almost all can already tell that their shoulders feel good and they can already tell a difference in the weight on their chest. And so that part they're still smiling about 3 months out. I do think that a lot of ladies tend to sort of be pulled and hunched forward by the weight of their breasts. Their shoulders tend to roll in and they tend to be a little curved through the upper back. And when patients come in and tell me that that's one of the things that they know about themselves, I tell them, like, at this point though, even though the weight is off, you're going to have to totally reset habits and strengthen your back and really train yourself. So it's not just that the breast weight comes off and your posture springs right back. It's a whole habit and lifetime of sitting in certain ways that has to be reversed. And they can at that point and hold it and have the stamina to hold it now that they're not lifting heavy breasts and being pulled at. But it's a process. We have photos on display at portlandplasticsurgery.com, also on our socials. And if you come into the office at any time, I can show you a list of before and after photos of folks who maybe weren't even comfortable with them being out in social media or out on the computers, but that are really happy with their results and happy to share with prospective patients.